Hey everyone, welcome back for another deep dive. Today we're tackling a topic that's really close to home for a lot of you listening. We're focusing on caregiver burnout, specifically for mental health nurses.
Yeah, this is something we hear about a lot in the field, and there's so much good stuff out there.
Exactly, and that's why we're digging into this blog post by Molly Flexwell.
Oh, yeah, she really gets it.
She does, and I think what really struck me is she doesn't just describe the problem, you know.
Right, it's not just doom and gloom.
Yeah, she goes beyond that and gives some really practical strategies for thriving in your role.
I think that's what makes it so valuable for mental health nurses specifically.
Totally. I mean, she even dives into some pretty surprising stuff. Like the importance of self-compassion as a way to build resilience.
That one's huge. And she also talks about how even small acts of kindness can actually boost your immune system.
I know, right? I was hooked right from the start.
It's fascinating stuff and so relevant for our listeners.
Okay, so let's break it down. What is Flexwell actually saying about caregiver burnout?
Well, she's really clear that it's not just about being tired.
Yeah, it's got to be more than that.
Exactly. It's this deeper exhaustion that hits you on multiple levels, like emotional, mental, physical. And when you think about the demands of mental health nursing, it's no wonder burnout is such an issue.
Yeah, and she keeps using these phrases lack of support and role confusion. And I feel like those really resonate in the mental health field.
Totally. You're dealing with patients going through some really difficult experiences, often with limited resources, and the system itself doesn't always recognize the complexity of the role.
It's true. You're expected to wear so many hats,
Yeah.
therapist, medication manager, crisis responder, and all while navigating a constantly changing environment.
It's a lot to handle, and it takes a toll.
For sure. And think about it. You're constantly exposed to other people's trauma, their pain, their anxieties. That's got to be emotionally draining, especially without clear boundaries and support.
Absolutely. And that's where burnout can really creep in.
And she lists all these sneaky symptoms too. Emotional exhaustion. Yeah, that's a given. But also constant fatigue, losing interest in things you used to love, even getting cynical or detached.
It's scary how it can sneak up on you.
It really is. I mean, have you ever noticed any of these in yourself?
Oh, for sure. I think it's important to be self-aware because ignoring those early signs can have some pretty serious consequences.
Right. And Flexwell even mentions physical symptoms like headaches or digestive issues, which we might not connect to burnout right away.
Yeah, it's easy to overlook those connections.
And then she brings in this research by Dr. Kristen Neff, which I found so fascinating. It turns out self-compassion isn't just some fluffy feel-good concept. It's crucial for building resilience, especially in caring professions,
Yeah, Neff found that mental health professionals who practice self-compassion are less likely to experience emotional exhaustion and depersonalization.
which are two major components of burnout, right?
Exactly. So being kind to yourself is like a superpower that helps you stay strong and avoid burnout.
I love that. So powerful. And Flexwell shares this really powerful anecdote about a nurse who learned this the hard way. This nurse was so dedicated, always going above and beyond for her patients, but completely neglected her own needs.
It's a classic story, unfortunately.
Yeah, she pushed herself to the limit. And surprise, surprise, she ended up completely burned out.
It's like the saying goes, you can't pour from an empty cup.
Exactly.
Yeah.
So what did this nurse do to turn things around?
Well, she started by embracing self-compassion instead of beating herself up for feeling burned out. She acknowledged her limitations and started prioritizing her well-being.
Wow, that's a big shift from self-criticism to self-care.
It is, and it made all the difference.
That's a huge step, right, for a lot of nurses.
Yeah.
I mean, it's so easy to get caught up in the demands of the job and forget to take care of yourself.
Yeah, especially in mental health nursing. I mean,
Yeah.
compassion fatigue is so real.
It really is. And that's why I love that Flexwell offers all these practical strategies.
Yeah.
Like, it's not just about the why of self-compassion, but the how.
Right, exactly. And she doesn't just throw out these vague suggestions like take a bubble bath or whatever. She gets specific, stuff you can actually integrate into your busy life.
Like, give me an example.
Well, she talks about setting boundaries, which we already talked about how that can be really tough for mental health nurses, but she offers some concrete tips like learning to say no to extra tasks or delegating responsibilities when possible.
Right. That's so important, especially when you're already feeling overwhelmed. Like, it's okay to ask for help or admit you can't take on everything.
For sure. And seeking support from colleagues or supervisors is another big one. Flexwell emphasizes that you don't have to go through this alone.
Yeah.
There's a whole community of mental health professionals who understand what you're going through.
She also mentions mindfulness, which I know can be a bit of a buzzword, but Honestly, I found it so helpful in my own life for managing stress.
Oh yeah, mindfulness is great, and it's not about emptying your mind or becoming some kind of Zen master. It's really just about paying attention to the present moment without judgment.
Right, just being present. And FlexWell gives some great examples of how you can incorporate that into your workday.
Yeah, like taking a few minutes to focus on your breath before starting your shift or practicing gratitude during your lunch break.
Little things like that can make a big difference.
Exactly. They can help you manage stress, cultivate a sense of calm amidst all the chaos.
And then there's this whole thing about kindness, which honestly sounds almost too simple, but FlexWell makes a really compelling case for it.
I know, it's amazing how something as basic as kindness can have such a profound impact on our well-being.
Right. And she actually cites research showing that acts of kindness can reduce stress hormones and boost the immune system.
Yeah, it's wild, right? Being kind is like a biological superpower.
I love that. And it's not just about being kind to others, although that's important too. FlexWell emphasizes the power of self-kindness.
Oh, absolutely. That's where it all starts, right? If you're constantly criticizing yourself or putting yourself down, it's going to be really hard to be kind to anyone else.
So how do we actually practice self-kindness?
Well, Flexwell suggests incorporating small acts of self-kindness into your daily routine. Like starting the day with a positive affirmation or treating yourself to something you enjoy.
I like that just those little things can really add up.
They can. And it's important to acknowledge your efforts to celebrate successes, no matter how small they may seem. Mental health. Nursing is hard work, and you deserve to be recognized for all that you do.
One thing that really stood out to me was FlexWell's emphasis on the ripple effect of kindness. Like, she argues that when nurses practice self-compassion, it not only benefits them personally, but it also creates a more positive and supportive environment for their patients and colleagues.
It's so true. It's like this chain reaction of good vibes when you're feeling grounded and cared for. You're better able to show up for others in a genuine and compassionate way.
And that's what it's all about, right? Providing the best possible care for your patients.
Absolutely. And Flexwell reminds us that taking care of yourself isn't selfish. It's an essential part of being a good nurse.
She also lists a bunch of organizations that offer resources specifically for nurses like Carers Australia and Beyond Blue. These are great resources for finding support and connecting with others who understand the unique challenges of mental health nursing.
Those resources are invaluable, especially if you're feeling isolated or overwhelmed. It's a reminder that you're not alone in this journey. There's a whole community of mental health professionals and support systems out there.
And for our listeners in Australia, she specifically mentions the National Respite Locator, which can help connect caregivers with much-needed respite services. Access to respite care can be a real game changer. It gives nurses a chance to step away, recharge, and come back to their work feeling refreshed and ready to give their best.
Yeah, it's about recognizing that you can't pour from an empty cup. You have to replenish your own well-being to effectively care for others.
So as we're wrapping up this deep dive, I keep coming back to this idea that self-compassion is like a superpower for mental health nurses. It's the key to preventing burnout, staying resilient, and ultimately providing the best possible care for your patients. It's like she's giving us permission
Yeah.
to put ourselves first, which can be so hard for people in caring professions.
Oh, yeah. It is. It's a big shift in thinking, but it's so necessary. I mean, remember, you can't pour from an empty cup. Taking care of your own mental and emotional well-being, that's not selfish. It's the foundation for being able to care for others.
So what does this all mean for our listeners, the mental health nurses out there?
Well, it means you have the power to choose self-compassion. You can choose to challenge those beliefs that say you have to put everyone else first. You can choose to set boundaries, seek support, and practice kindness, not just towards your patients, but towards yourself.
And those choices you make, they have a ripple effect, right? Like when you prioritize your own well-being, it's not just helping you, it's creating a more positive environment for your patients, your colleagues, everyone around you.
It's true. It's like this chain reaction of compassion, and it all starts with you.
I love that. And, FlexWell's blog post is full of practical tips and strategies. But as we wrap up this deep dive, I want to leave you with this thought. What's one small act of kindness you can do for yourself today?
It could be anything, really taking a few minutes to meditate, going for a walk in nature, calling a friend, or even just saying no to something that's adding to your stress.
Whatever it is, make that commitment to prioritize your well-being. Remember, you deserve to be cared for just as much as your patients do.
And if you're looking for more support or resources, we highly encourage you to check out Molly Flexwell's full blog post. She provides a ton of information and links to organizations that can help.
You're not alone in this journey.
Yeah.
There's a whole community of mental health nurses and resources out there to support you.
So until next time, take care of yourselves and keep diving deep.